But right now, back to the business of Botox. Here's Dr. Joseph Berardi to fill us in.
One common name that you'll hear is Botox, and Botox is a botulinum toxin. And just like botulism, what it does is relaxes muscles. The way Botox works is it blocks the neuromuscular junctions between the nerve saying flex the muscle and the muscle itself. So it relaxes muscles and it takes away the ability for those muscles to form wrinkles. Most of the time we're injecting Botox around the eyes, between the eyebrows, forehead, on the side of the eyes, but we can also use Botox around the lips, around the chin, sometimes in the neck for muscular bands. It's actually a wonderful procedure to do that we can do in the office. Same day, obviously. Usually it takes about 3 days to start working, 2 weeks to take full effect, and longevity should be about 4 to 6 months, though this might vary from person to person. Side effects with Botox are fairly uncommon, but what we might see is bruising. Bruising is an important one because people come in, they want to go to the office, and we usually subside that bruising with potentially taking some herbal medicines, decreasing their activity levels after they do Botox. Some might get headaches because we're initially irritating the muscle, which can cause the headache, but that usually resides within a day or so.
The advice I give to other patients seeking Botox is make sure you go to a doctor that knows what they're doing, because there's times where you can go and your results are not maybe as even or not the result that you're looking for. With Dr. Berardi, everything he says is actually perfect. To the consultation with Dr. Berardi, he is amazing. He's soft-spoken, which is really nice. He doesn't make you feel crazy and scared. From the time you sit down, he'll say, what is it that you're looking for? It helps me feel relaxed, and he usually will tell me to do some squeezies just to make sure where he's going to put the Botox in is going to be the right place. And usually when he does do that is exactly where it is. And when I'm done, it's fantastic after 7 days.
So just for comfort reasons, we'll use an ice pack. It also helps vasoconstrict or shrink blood vessels, so we're a little less likely to see bruising. So we're going to do 3 areas today. Again, some of the more common areas are between the eyebrows and on the sides of the eyes. Between the eyebrows, there's the corrugator muscles. Go ahead and ice. These muscles are a little bit deeper in the face, so usually putting the needle in a little bit deeper, usually using a little higher dose because it's a pretty strong muscle. So I'm going to do a little touch. And you go ahead and ice again. And the Botox will diffuse a little bit, so it'll touch on some other muscles in the area. Sometimes people get these little bunny lines from a procerus muscle, and this will usually diffuse enough to take care of those muscles as well. So the side of the eye usually addresses what we call the crow's feet. So when people squint, muscles will form, or wrinkles will form on the side of the eye. Very common in Arizona because how much sun we have. So, and this muscle is a little more superficial, so we'll put sort of a wheel of Botox, and this will help it diffuse because this muscle goes completely around the eye. So I usually tell patients don't do exercise for the rest of the day, don't lay down for approximately 4 hours or so, avoid wearing constrictive hats. So in the third area we're going to do is just above the eyebrow. For people that want a little more arch in their eyebrow, for just a little, very subtle lift, you can do a little Botox just under the peak of the eyebrow, and this is going to help relax the muscles that pull the eyebrow down.